And today I'm going to be demonstrating to you how to be placing the patient on a non-invasive positive pressure ventilation. So first what we're going to do is we're going to look at the patient's chart. We're going to look at doctor's orders. We're going to look at any trending vital signs that the patient has. We're going to look at and see what the reason is for the patient's visit. With that said, we want to make sure that the patient meets the criteria in regards to being placed on this machine. So we want to look at indications. So look for indications, and some indications for it would be a patient who has CHF, congestive heart failure, or a patient who has a neuromuscular disease, or it could be a patient who is post extubation and needs to be weaned off of the ventilator. Some contraindications in regards to this is that it could cause patient aspiration, and it could another contraindication would be a non-compliant patient, or it could cause a contraindication would be anybody who is an apneic patient. Some risks associated with this that the patient may experience is vomiting due to the aspiration, some skin lesions because they're going to be placed on a mask, so it could cause some skin irritation, and also some bariatrial trauma. Okay, so what we're going to do next is we're going to go ahead and gather our equipment. So I'm going to make sure that I have my flow sheet, because I'm going to be documenting the patient's settings on this flow sheet. After I'm done, I'm going to go ahead and grab the machine. I'm going to grab the 3 masks. We want to grab 3 masks because we don't know the size that the patient is going to be using. So we're going to grab a small, medium, and a large. We're going to also grab our circuit here. We want to make sure that we have the expiratory port for it. And we also want to make sure that we have a full tank of oxygen connected to this, just in case there were to be an emergency and the patient needs to be transported. We want to make sure that we have a full oxygen tank so we could be able to transport the patient. And then when we connect the port or the machine, we're going to go ahead and connect it to oxygen. We're going to connect it to the wall to oxygen. And then we want to make sure that when we connect the machine, we also want to connect it to a backup generator, just in case there were to be an emergency. This machine is placed on a backup generator just in case of an emergency. Okay. So I'm going to go ahead and, I entered the room and I connected the machine, and so now I'm going to go ahead and clean my hands. I'm going to use 3 ml hand sanitizer. And hi, I'm sorry, I just came in, I started connecting the machine.
It's okay.
My name is Mickey, I'm a respiratory care student. Can I have you state your name and your date of birth, please?
My name is Ruby Robles, and my date of birth is 01/27/1993.
Okay. Okay, and do you prefer to be called Miss Robles, or is Ruby okay?
Ruby's okay.
Ruby's okay? Okay, so what I'm going to be doing is I'm going to be setting you up on a machine that's going to help you breathe better, because it seems as though, I'm sorry, before I continue, can I just verify?
Yeah.
Oh, okay, perfect, thank you. So it looks like you've been having some difficulty breathing, and so what this machine is going to do is it's going to go ahead and help you breathe better, okay? And so the way it's going to do that is that it's going to go ahead and apply positive pressure, and it's going to be triggered by your own breath. Okay?
Okay.
That way it could go ahead and decrease the work of breathing that you're experiencing, the difficultiness, and then that way it could help you relax and help you breathe a little bit better. Do you have any questions?
No.
No? Okay, and then so you also want to make sure that if there's any family members in the room, you want to make sure that they understand the procedure as well. And then before doing all of this, you want to go ahead and obtain the patient's vitals, respiratory rate, heart rate, and then their oxygenation, any vitals, the normal vitals. So what I'm going to do is I'm going to be measuring you for your size mask because it's going to be a mask that you're going to be wearing. Okay, so you're going to go ahead and there's a cheat sheet here. And as you can see, it's small, medium, and large. So you just want to measure the patient's face first. I'm going to go ahead and I'm going to be going into your personal space. Okay, so I do apologize. So I'm just going to go ahead and when you're measuring, you want to start. You want the top to be at the bridge of the nose, and then the bottom to be at the bottom of the lip. Okay, so I'm going to go ahead and see. Okay, perfect. So it looks like the patient is size small. Okay, and so I'm going to go ahead and grab the mask. Before I give the patient the mask, I'm going to look at the number here because we're going to need that number for our settings, okay? So what I'm going to do, Ruby, in the meantime, is I'm going to have you look at the mask while I work with your settings here, okay? Thank you. Okay, so what I'm going to do is, now all of these settings are all going to be based off of doctor's orders, where the doctor has ordered to place the patient on for these settings. And all of these, the settings will also be triggered off of the patient's, because the patient's going to be spontaneously breathing on their own, and so this is how all of the settings are going to be triggered off of the patient's breath, okay? So first we're going to go ahead and set the inspiratory positive airway pressure, which is also, for sure, it's an IPAP. And so, again, we're going to look at the patient's order. So today I'm going to start off the patient at 10. I'm sorry, actually I do apologize. Before I do all of this, we want to make sure that we have a functioning machine first. So the way we're going to test the machine first is we're going to go to the menu, we're going to hit mask port, and as indicated, I saw the number 1 on the patient's mask. So I'm going to choose 1 on here, and I'm going to accept. Now in regards to the exhalation port, we're going to look to see if it's one of the ones that is here, which in this case it's not. So I'm going to go ahead and choose other, and I'm going to hit accept. It says to disconnect the patient circuit. So I'm going to go ahead and occlude, but I'm going to leave the exhalation port open, and I'm going to start the test. Again, we want to do this before we do anything else because we want to make sure that the machine works properly before applying it on the patient. And so as long as we pass, so that's good. So now we could go ahead and proceed on with the settings. Okay. And so again, we're going to start off on the IPAP, which is the inspiratory positive airway pressure. And as I mentioned earlier, I'm going to start it off at 10. Again, all of this is based off of the doctor's orders. And actually before setting, we're going to go to modes. Choose batch ST, which is batch spontaneous time. Again, patient's breathing. Now we could set the modes. My goodness. So IPAP 10, accept. And the IPAP is based off of patient's ventilation. So if the patient were to have a high CO2, then we want to increase their IPAP. Now the EPAP, which is the expiratory positive airway pressure, that is based off of patient's oxygenation. And so if the patient were to have low ventilation, then we want to go ahead and increase their EPAP. Now one thing to keep in mind is that when we do increase their EPAP, we also need to increase their IPAP at the same time. And when you're increasing or decreasing either one, you will do it by increments of 2. Okay? So we're going to start out their EPAP at 5. The rate is in regards to the patient's breaths, that they're the respiratory rate. And so the normal is 12 to 20. So in this case, we're going to go ahead and start it off at 12. And then their FiO2, again, we're going to look at the patient's chart. And if the patient were to be at a FiO2 of just say 45%, we're going to go ahead and place the patient on 45% of oxygen, FiO2. But we're doing room air right now, so that's 21%. Their I time is the I time is from the time from expiratory pressure to inspiratory pressure. So we're going to do that in 1 second. The rise is basically for patient comfort in regards to how fast that pressure is going to be delivered to them. So if it's at a rise of 1, it's going to deliver it very fast. If it's at a rise of 5, it's going to deliver it a lot more slower. So we're going to set it at 3 in the middle, and we could always just make adjustments. We could always make adjustments to any of these. The ramp is basically, at first it could be a little bit hard for the patient to adjust to these settings, and it might be a little too intense. So what the ramp does is it allows, it slowly provides these pressures to the patient at a slower rate, slower time, so the patient could adjust to it. And then once the patient is fully adjusted, then I'll go ahead and deliver it at the settings that I gave them. Okay, so now we're going to go ahead and activate the badge. And what we're going to do is we're going to hook the patient up to the mask. Okay, so again, I apologize. I'm going to come into your personal space here. I'm going to ask you to just go ahead and hold this for me, please. Thank you. Okay, we're going to put this over the patient's head here. Okay. You're going to feel some tightness. Oh, sorry about that. Okay. And so when adjusting the mask, because we want to make sure that there's a good tight seal, because we want to avoid any leaks. When you adjust them, you have the straps here, and you want to adjust them at the same time. Okay, so just, are you okay? Is that okay? Okay. And then at the same thing, the strap on top. And so another way to check to see if it's too tight or anything like that, we could just, if we could slip in 2 fingers, that's a good indication that we're good. It's a snug fit. Again, if it's too tight, it's going to probably cause some skin lesions on the patient, you know, some irritation and everything like that. You're doing okay? Okay, and so then we went ahead and set the patient up on the mask already. Now the patient is going to go ahead and be breathing spontaneously. And so now we're going to be able to set the patient's alarm settings. So I'm going to go ahead and go to alarm settings. And so the high rate is going to be based off of the patient's respiratory rate. So right now the patient is breathing a respiratory of 22. So we want to increment it by 10. So I'm going to go ahead and go to 32, a high rate of 32. That way, in case the patient starts breathing at a high rate of 32, it's going to alarm me. And in the low rate, I'm going to go ahead and put that one, we're going to go down 10 again. So we're going to put that one, let's just say, since it was, at the moment it was 22, I'm going to go ahead and put that one at 12. High tidal volume and low tidal volume. The tidal volume is right here, so the patient right now is breathing a tidal volume of 600. So when we make those adjustments, we're going to make the adjustments in increments of 300. So the high tidal volume, since well, now it's at 586, so I'm going to go ahead and put it at about 880. Okay, and then again, on the low tidal volume, I'm going to decrease it by the 300, so I'm going to put it at about 200. Okay, now the hip and the lip, the hip is the high inspiratory pressure, and the lip is the low inspiratory pressure, and those two are based off of the patient's positive airway, inspiratory pressure, and those are going to be by increments of 5. So right now her positive inspiratory pressure, which is also known as PIP, is at 10. So I'm going to put the high inspiratory pressure at 15. Okay, and then the lip, I'm going to put it at 5. It's already there. The minute ventilation, it gives you the minute ventilation right here. So she's at 6. Here it's at 10.8, so I'm just going to go ahead and decrease this, and I'm going to put it at 3. And the low inspiratory pressure time is if the patient is breathing a low inspiratory pressure of 5. It's going to alarm me within 3 minutes that the patient is breathing at that rate. So I'm going to go ahead and leave it right there. So we already set the alarms. So we're set to go. So before I leave, I'm going to go ahead and let the patient know. In some cases, it might cause you to, in case you feel any chest tightness or any, if you feel like vomiting, then you go ahead and call the nurse. Let me show you how to go ahead and remove the mask. In case you need to vomit, you could go ahead and remove it. So there's some hooks right here. You could just go ahead and detach them. Okay? Like that, and then you can just remove the mask. Okay, so I want you to show me how to remove your mask. Okay. So what I'm also going to do is I'm going to obtain the patient's vital signs again while the patient is on the mask before I leave the room. Do you have any questions? No? Okay, so again, my name is Mickey. Okay, you just give us a call if you need any assistance, okay? Okay, so I'm just going to go ahead and I'm going to remove my gloves. And I'm going to go ahead and sanitize my hands. I'm going to leave the patient's room, and what I'm going to do is I'm going to go ahead and make my documentations of the settings that I put the patient on my flow sheet. And then I'm going to also record my vital signs that I took pre and post. I'm going to also check in case there's an order for an ABG to be done. We want to make sure that we leave the patient on this machine for the minimum of 30 minutes before pursuing with an ABG. And because we want to make sure the patient adjusts to those settings first. And then the doctor may order a chest x-ray to make sure that the patient does not develop any barrel trauma. And yeah, that's the way on how to place the patient on a non-invasive positive pressure ventilation.